Good evening, everyone. I'm Darrell Steinberg, your mayor, the mayor of Sacramento. Welcome to another edition of A Shot of Truth, which is our semi-weekly effort to get the word out about the importance of vaccinations and to bring in community leaders who are on the front lines, working with our diverse communities in Sacramento to make sure that everyone is safe, that everyone gets vaccinated, and that we put this COVID-19 experience behind us. We have a lot of work to do. Our vaccination rates in our county have gone up thanks to the work of our public health officials, as well as the community-based organizations that are just working so hard to demystify vaccines, to separate myths from facts, and to consider everyone and every family important, which they are. You know, statewide, the vaccination rate is 56.7%. In our county, it's just a little bit below, 55%. And we're not in competition with the rest of the state necessarily, but when I look at 55% fully vaxxed, that means that 45% are not, and we have a lot of work to do. So without further ado, let me bring in our two esteemed guests tonight. Let me introduce first Vang. By the way, both of these leaders are from the great La Familia Counseling Center, one of the most important nonprofits in our community that does so much economic empowerment for lower income communities, especially the Latino community, but not limited to the Latinx community by any means. On the front lines of helping people dealing with mental health issues, so much community building, and of course have been leaders on the fight to make a shot of truth become a reality here in Sacramento. So Vang is the Youth and Health Program Manager at La Familia, leading the COVID-19 weekly testing, the vaccine clinics, the wraparound services, and provides COVID-related resources and services, including general health education to the underserved communities of Sacramento. She also oversees several youth programs around STEM, which is, of course, science, technology, engineering, and mathematics, youth pop-ups, which is a major city initiative, and youth leadership programs at La Familia. Welcome to you, Mal. So glad you are here. I don't know how you have any time in the day with all that portfolio, but welcome, and I will get to you in a moment after I introduce our second guest here is Adriana Martinez, is the program coordinator for La Familia's agricultural program, Safe Harvest. Through her leadership role, she provides supportive services to agricultural workers, the people who bring us our bounty. And they've had it especially tough during the COVID-19 health crisis. She oversees implementation of the program and ensures that rural communities are reached with COVID-19 resources. She has vast experience previously as a community mental health worker through the Latino Support Center. And most recently, she began her role as a graduate student clinician and is providing mental health services to youth 21 and under. You know, I will just say, before we get into the discussion, COVID-19 is the pandemic, mental health may be the epidemic, and certainly in part connected to what everyone is going through during this pandemic, the loneliness, the isolation, the anxiety, and all of it. So maybe we'll have time to touch upon it all. But let me be quiet and turn it over to both of you to ask you, just maybe to start, to share in broad strokes some of La Familia's ongoing efforts to help create higher vaccination rates with not only the Latino community, but to our other diverse communities in Sacramento. Go ahead, Mal, why don't you go first?
Yeah, thank you so much, Mayor Steinberg, for that beautiful welcome, for me and Adriana. When the when the vaccine first rolled out about in January and February of 2021, a La Familia, we knew that we had to do something about it. You know, the Latino community makes up about 30% of the Sacramento population. And not only that, but at La Familia, we serve not just the Latino community, we served our unserved, underserved, vulnerable, our Hmong community, our Middle Eastern, our growing Russian community. And so we knew we had to get to this work because our colored community and especially our Latino community are they are at the heart of the essential workers doing those essential work. So we knew that we had to get moving and get vaccines over to them. Um, Adriana, I'll let you fill in if there's anything else that I missed there.
Thank you.
Go ahead. Welcome again, Adriana.
Yes, thank you. I really want to talk about our efforts and how La Familia has been able to really get those rural communities green and orange, which means over like 70% vaccinated, which is a huge success for us because we did a lot of work over there. We did intentional vaccination clinics out there at work sites, local community schools. So, you know, since the beginning, like Mal mentioned back in February, when we started getting like 150 slots for vaccines, they would quickly get filled up. But what we started doing is we reserved about like 50 for our agricultural workers. We worked with the farmers and the employers to let their workers get paid time off. And then they provided free transportation to get them to La Familia so their workers can get vaccinated. So it was efforts like that and those partnerships that really helped the vaccination efforts. And later on, we began hosting vaccination clinics at the workplaces. We began opening, when the tiers began to open up, we began hosting sites like in general community locations. So community members had like an established location where they knew we were going to be there like every month or every other month. We provided them like one hotline number where they can contact us, where we have a 24-hour answering service. So in case they missed us, we call them back then right the next morning and we let them know about our vaccination clinics. We let them know about the nearby clinics that they can go to. So that was just our effort around the agricultural and the rural communities of Sacramento, which really, really paid off. Because if you look at the numbers now, those communities are orange and green.
Right. Well, congratulations on that. Before I go into a little bit more detail with you about how easy it is to access vaccinations, given the work that you are doing, Adriana, would you mind just saying in Spanish that we are going to reproduce this conversation in Spanish to our Spanish-speaking audience on YouTube and on Facebook Live after we finish here tonight. So we're going to do our very best to make sure that this is accessible to as many people as possible. Would you mind doing that? Thank you.
Los subtítulos en español estarán disponibles en el canal de YouTube después de esta grabación para que nuestra comunidad que hable español también tenga la oportunidad de escuchar este mensaje importante hoy.
Gracias. So I want to just get into a little bit more detail here between the agricultural, our agricultural workers and our other working families in our communities. Tell the audience how easy it is for people to get vaccinated. In other words, I know that my colleagues, council members Guetta, council member Vang, in the South area have both led efforts to provide vaccination opportunities for people. So what La Familia is doing, how easy it is it to access a place to get vaccinated, the hours that you are available, the different locations, lay it all out for people so that they get a sense that this is not a hard thing to do.
Yeah, absolutely. I agree with you, Mayor Steinberg. The vaccines are not hard at all. I mean, our local pharmacies from Walgreens, CVS, Walmart, they have the vaccines right now. Many of them don't require an appointment. And so let's say maybe you have something planned and then maybe it cleared up. You can just walk in and they will see you right there and then and give you a vaccine. Something else that's not hard, not just the access at your local Walmart pharmacies, but something that's simple is calling La Familia. If you don't know what to do or where to go or where to look, you call La Familia or go on our website, and we can provide you that information. We
What
have
is that number, Mo? What is that number? Let's lay it out there.
Sure, we could put out the two numbers. So we have two office at the Maple Neighborhood Center where the health team is located. Our number is 916-210-8773. And then the number to our main office is 916-452-3601. I got those two memorized by heart, but they can just call because really what we are here for is we are really here for the community. Whether you have a concern or whether you don't know where to go. And let's say we have a vaccine at our Maple Neighborhood Center and you cannot make it, we will help you look for one, whether it's at the Pinnell Center, at the Cerna Center, any of our partners, any pop-up vaccination clinics, or any reoccurring. And so it's not hard at all. The myturn.ca.gov is a website that they can also go to. They can call 211 and the dispatcher can help them as well. But when they are in doubt and when they are not sure, they can call La Familia and we will redirect them. If we don't have it at La Familia or if one of our partners doesn't have it, we can help them locate that. It's super simple. It's not hard. And we want to make sure that you are aware if you're watching this, that it's simple. It's not hard at all. It's picking up the phone, dialing it, calling, or going on the website and looking us up. As mentioned earlier, our website, lafcc.org, we have a separate tab just for vaccinations that our admin team update weekly about all of the vaccine clinics that La Familia offer or we're partnering with, whether it's at Mirancho or La Superior, La Esperanza, Bowling Green, some of our other partners. We have all of the information there. And so you can look at which site, which location, which time works best for you.
And there's flexibility. So, I can imagine that working people and, maybe people have different shifts as well, that, they say, let's say somebody who's got a daytime shift. And they say, I cannot miss work. I'll be at risk of losing my job or losing my pay for the day. Is there flexibility in terms of time when people can get vaccinated? I know you talked about the Rite Aid and Walgreens and CVS and some of the other places, but what about with La Familia and some of the programs that you are running?
Yeah, great. I can speak on that. So our vaccine clinic right now at the Maple Center is twice a month. And so we'll have it twice a month because we'll have it. And then the Pfizer, we wait 3 weeks and then we rotate our vaccine clinics. Right now, they're actually from 4 to 7 p.m. And that's exactly right because we understand that our community, they work, they have kids, they may not have that time. And so we moved our vaccine clinic to 4 to 7 p.m. And then, of course, we do have partners who do have vaccine clinics in the daytime that we partner with. So, for example, we'll be going to Bowling Green. We'll be going to Bowling Green and doing vaccine clinics from 9 to 12. And so we actually, at La Familia, we staggered our vaccination clinics. You have some from 9 to 12, some from 12 to 4, and some from 4 to 7. And they're actually staggered to make sure that we can, the community can get to us and access it. Something I do want to share as we're talking about vaccines is, and I forgot to mention earlier when we were sharing our effort is, we started a Amigos y Compadres, also known as Family and Friends Referral Program. And that referral program is if you bring a family and friend to get vaccinated, they get a $25 gift card, and so do you. And the reason why we're doing that is because we know that in these last stretches, it is our family and friends who will get us through. It's that personal stories we have to share, right? In the Latino community, in a lot of culture community, specifically Latino, they have what we call familismo, which is a value of the family, right? Family oriented. And so we need our family and friends to get their family and friends to come through and get vaccinated. And then of course the $25 for the person getting vaccinated is because exactly of that. Some of them don't get paid time off. They don't get the work time off. Or they're taking care of their children, and it's just so hard for them to make it out. But if I say I'm giving you $25 to take 30 to 45 minutes of your time to come get vaccinated, like that's a great incentive. So don't feel that you're not getting paid or not getting time off of work. We really want to encourage folks to come by and get yourself vaccinated and protect your loved ones.
Very good. Thank you, Adriana. Let me ask you about one of the challenges I know we hear about all the time, which is real, which is immigration status and the fear from those who may be undocumented that if they step forward to get help from any kind of a government program, that they might risk being deported or raided, which of course it just breaks my heart. Working families, right? And what do you say to folks, and how do you get through that challenge?
Yeah, that's definitely a huge concern, especially in our Spanish-speaking households and our mixed status families, that there may be some concerns around public charge, but mostly about confidentiality, whether their information is going to be kept safe. So what we want to say to these mixed status families or families that don't want to come because access the vaccine because there is that fear around immigration is that their information is going to be kept safe and confidential, that their immigration status is not going to be shared, and it's not a factor for them not to be able to access the vaccine.
So let's move, and I'll ask you to start on this one again, Adriana, which the issue which seems to plague us in every context, in every conversation around COVID, and that is the issue of vaccine hesitancy. People who, there are some who, have a ideology, it's become political, right? We know that. But then there are people who just are hesitant because they have a fear, they've heard something from another source. Are we making progress, first of all, as you've seen the arc of this in our county and with the people that La Familia serves? Are we breaking through around vaccine hesitancy? Or I know it's still a major challenge, but how much progress are we making?
It's definitely still a challenge. I think what the major misconceptions in our community we've heard is that the vaccine or the lack of information, that the vaccine gives you COVID, that it has COVID inside, that, fertility issues. So those are some of the common misconceptions that we hear. So that's why we tend to tackle this with education. So COVID workshops in Spanish, we had them in different languages to make sure that when we provide the education, we talk about some of the misconceptions, and that will definitely, maybe break in. And some people do go get the vaccine after they get reassured, especially when it comes from a trusted messenger like La Familia, and education is accessible in their language. There may be some folks that are then reassured that the vaccine is safe. And of course, there's the other pool of people that, it takes more work to get them to get the vaccine.
Now,
you want to answer that one as well, please?
Yeah, I think something that I just want to add on to that is, there's definitely misconceptions out there, but, we're here to really do those workshops and really educate the community. Not just us, but family and friends that have been vaccinated. And I want to address that there are many people that are unable to get the vaccine and that we are all protecting. Right? Those are our community members who are immunocompromised and cannot get vaccinated. Our younger kids who are not at of age yet to get the vaccines. Family and friends we know that are going through chemotherapy and radiation. And so there are many people who are unable to get the vaccine. And yes, there may be misconceptions and concerns, but you know, if you can and you're not immunocompromised, not going through those, we highly encourage you to get the vaccine. Protect your loved ones. You never really know when you're going to work. Your colleague, their husband may be, going through cancer treatment. You never know what's happening around you, and let's all help one another and be considerate of each other. And if you have these misconceptions, let us get through them together, whether we need to connect you with, our county or city or doctors, nurses who can get any of the questions that we cannot answer for you. Let's move towards that.
Sure. I want to ask you about La Familia and other community-based organizations using mobile clinics to actually go on out to various communities. Currently we've got a number of situations, one in South Sacramento around Joseph Bonheim, the new Joseph Bonheim Elementary School, where the teachers have not come to work over the last couple of days. And certainly that's an issue that we're talking about now, and the public health officer, Dr. Cassirier, is on this and has recommended that the school remain open and that there be a regular testing regimen. And that's one set of issues that we are dealing with because those kids have to go to school. The broader issue, though, is how do we look at pockets where there is real stress and real impacts, and kind I just described, and actually bring the clinics out to places like Bonheim. For example, at Bonheim, if we said, let's bring a vaccination clinic out to an elementary school or several elementary schools during the course of a week, is that something that we could all do together?
Absolutely. That is exactly what La Familia, what we're doing right now. And let me just share that just this month of August alone, we have done 10 vaccine clinic. And that was just in August alone. I mean, we've gone to National Night Out, Mariachi Festival. We're going to be heading to Rosa Park, Bowling Green, our local grocery stores. And so we're really here because we understand that right now it's about that intentional, intimate work, right? That intentional of going to these places for our community. And so we would love to partner and help and this goal in any school, in any way that we can, and get our community safe. So absolutely. We also have a great relationship working with Sacramento County, Syria Health Foundation as resource coordinators, and a few others as well. And so we can definitely help bridge that gap, organize it, coordinate it, and go out there. So let me know if there's a point of contact or anything of that sort. And then we can definitely, Adriana and I can definitely coordinate and get a team out there to vaccinate, test, whatever the community need, we are here. And
So just hypothetically, because I don't want to plan our mobile clinic over the live stream here. We should probably get more detail off. But just hypothetically, if you went to an elementary school, how many vaccine kits could you bring with you? In other words, could you bring enough of a supply to be able to vaccinate the number of family members, for example, of kids who were not vaccinated?
Absolutely, we can. We work with Sacramento County and some of the providers to provide that, and so I don't see a problem with that. We've been doing vaccine clinics since February 2021, and we have not come across that issue at all. More is always better, and so if folks are willing to get vaccinated, definitely yes. I do just want to reiterate that right now the vaccine is for 12 years and older, and
Right.
so.
Not the little kids, not the
Yeah, not
elementary
the
school.
little kids, but definitely
Right.
their siblings, their parents. We definitely can. And so I do not anticipate that to be any issue at all about short on vaccines. I think we're going to have plenty of enough. We've been going to many of our vaccine clinics, and we offer the Pfizer. Pfizer for 12 years and older is actually the only one that's approved. But for any parents who want to do just the one dose, we do offer the Janssen as well.
You do. Okay. As they say in the business, my people will talk to your people. We'll be in touch here on maybe a really important opportunity in the next couple of days. Adriana, I want to go back to you for a moment and maybe shift the conversation, just because both of your resumes and your responsibilities uh, are so diverse and deep. But you're a mental health worker, and tell me about what you do at La Familia around the issues of mental well-being.
Yeah, of course. So my background is in social work, but right now I'm pursuing my graduate degree in social work. So with the interest in clinical work, which is mental health. But when I started with La Familia, I started in the Latino Support Center, which is to be able to provide mental health services to Latino adults, because we know that Latino adults, some of them don't have there's not many Spanish speaking therapists out there, or they may not have a health insurance that they can afford a therapist. So this program started as a research project, and before we even started to do really heavy outreach, we just seen the huge need. And our perspective was that Latinos were not going to be open to mental health services, but no, they were ready. The stigma there, some stigma around mental health may still exist, but now they are more open to receiving mental health services for them and for their children. So I'm no longer in that program anymore, but it still exists at La Familia. So if you are an adult, Latino, Spanish speaker, we have a therapist, a Spanish speaker, short-term mental health. So I think it's up to 7 sessions, and then you get referred out if more sessions are needed. But it really is a great program. And then we also have mental health services for 21 and under youth that have Medi-Cal. And that's currently where the program that I'm currently in right now as well.
And have you seen a huge increase in demand over the last 20 plus months?
Oh, yes, we definitely did, especially for the children, because the children are isolated. That human connection that they would get in school, that social connection that they would receive at school was taken away from them. So
Yeah.
also, like, we had to shift to telehealth, and a lot of youth, yes, they thrived in telehealth, but other youth are different. They wanted that person to person connection. So right now that schools have started to open up, now our therapists, we're going out there to schools to have our sessions there. We offer sessions at home and at the office as well. But something I'm really noticing is just anxiety, isolation, depression. Last year, I did my internship at Hiram Johnson High School. So I was working directly with high school students. And same thing, I've seen a lot of isolation, a lot of anxiety, just that anxiety about the unknown and what's going to happen to my family, what's going to happen to COVID, on top of them dealing with their own anxiety issues, with their own depression and isolation. So it's a combination of a lot of stressors for our teenagers and our youth right now.
No question. And so just once again, a family or a young person needed to talk to somebody about what they were going through, give me an easy number here, an easy place for them to access that kind of help.
Yeah, I'm going to give you the mental health department phone number, which is 916-210-8773. And that number will
Say that again, Adrian. I'm sure, I think it got skipped a little bit. Go ahead.
Okay, it's 916-210-8773. So that number is for any adults that are seeking mental health services through our adult program, or if they want to register their children 21 and under to get mental health services with La Familia.
Very good. We're coming up on a half an hour, and even though, we could go as long as we want, actually, but I know you're busy, and a half hour is probably pretty good. But why don't we conclude just with a couple things here? Number one, I want to make sure that we repeat the phone numbers for people to be able to pick up the phone and call. So let's do that. But also make the case here for why getting vaccinated is so crucial to the health of all of our communities and neighborhoods. Why is this so important? And why is it continue to be so difficult to go from 55% of the county being fully vaccinated to 95 or 100%? Make the case. It's yours.
I can definitely start off first. I think the important lesson and the takeaway here is, when you get vaccinated, you're less likely to be hospitalized. You're less likely to die from COVID-19. And that to me is the biggest important lesson is, we are human beings, and we don't know where we will be, but it's been proven that getting yourself vaccinated, your chance of going to the hospital is less, and your chance of dying is less. That is the most important takeaway for me. I think the second one is, I mentioned earlier that it's a public health concern, right? We need to protect our family, our friends, our peers, our community, and that's really what it's about. We need to protect each other. This is not about you or me, it's about all of us together. And how can all of us together protect each other and stand together as one to make sure that we protect our family and friends that are going through chemotherapy, radiation, immunocompromised, our younger kids who are unable to get vaccinated. And I want us to be considerate, and that to me is the biggest reason why I cannot stand to see my neighbor, my family, my friend, my colleague, someone get hurt because we were not vaccinated. And so the FDA has given full approval, and so please get vaccinated.
Thank you, Adriana.
I think same thing that Miles said. I know for me, the reason why I got vaccinated is because I want to be able to protect the loved ones around me, my family, especially my grandparents. And that was just a major factor of why I wanted to get vaccinated. I know are other people out there that are very family oriented, especially our Latinos out there. So I just want to encourage you, do it for yourself and do it for the loved ones.
Thank you. I think it's important to note that La Familia also offers services to other diverse communities within Sacramento. You offer services in Spanish, obviously, in Hmong, in Arabic. Am I leaving anything else out?
I think those are the three that we do have right now. We do, like I mentioned, work with the High Middle Eastern and Russian community, and we're working on bringing more, of course, definitely more staff who speaks those language, but we're continually building that.
That's terrific. And finally, Andrew Kehoe, I know, has helped produce this. If you could put up the flyer that shows where the next couple of vaccination clinics are going to be held in South Sacramento. Let's see how good my eyes are here. Got one at St. Paul's Missionary Baptist Church this on September the 10th. The Multicultural Gospel Festival at McClatchy Park on the 11th on Saturday. Lady of Guadalupe, I know Eric Guetta is helping organize a couple of these on September the 12th. The Oak Park Community Center also on September 12th. There are plenty of opportunities. I think the takeaway here for me tonight is that you have a great organization like La Familia, who is not only providing the services and the vaccinations, but they can be a resource for anybody to help them get it, even if it isn't directly from La Familia. And secondly, that the community, and it's not just La Familia, it's the other groups as well, are willing to go on out to the community, to a specific school, to a community center. It's what you've been doing for many months to bring the vaccinations directly to the people. And so every option is available because all we want is a shot of truth. All we want is for the people of Sacramento to get vaccinated, to be safe, and to be able to put this behind us so that we can live life again and enjoy and be with our friends and our family and our community. Thank you very, very much, Vang and Adriana Martinez, for not only being on the show tonight, but for your selfless work and dedicating yourself to the people of Sacramento and the people who need a voice and who don't always have that voice. I'm really proud of both of you and honored to talk to you tonight, okay?
Thank you. Thank you so
Thank you so much.
Thank you so much. Have a good evening, everybody. See you next time. Bye.